At the same time of data extraction, one important task to complete is the risk of bias assessment of the eligible studies. Before we talk about bias and errors in research, we first need to understand variability. Variability simply means that people are different. Not everyone responds to a treatment in the same way. So, some people may benefit a lot, some a little, and some not at all. In this picture, you can see a group of people spread out across a curve. Most people are in the middle, but some are at the lower or higher ends. This natural variation happens because of differences in age, genetics, health status, lifestyle, and many other factors. So, even if a drug truly works, we will still see different outcomes across individuals. This natural variability is normal, and it's the reason why we use statistics to estimate the average effect of the treatment. Now let's move from variability to random error. In research, we try to estimate the true effect of a treatment. In this example, the true effect is a 30% relative risk reduction, shown by the black vertical line. But when we run studies, we don't get exactly the same result every time. Instead, we get slightly different estimates, shown by the stars along the curve. These differences happen because of random error. Random error is caused by chance, sample size, and who happens to be included in the study. Even if there is no mistake in the study design, random error still exists. The key thing about random error is it causes results to scatter around the true value, but it does not systematically push the result in one direction. With larger studies or more data, random error becomes smaller and our estimates gets closer to the true effect. But bias is very different from random error. Bias is a systematic deviation from the true value. In this slide, the true effect is still 30% relative risk reduction, but one of the curve is centered around 40 instead. That means the result is not just randomly different, it is consistently wrong. This happens because of the problems in the study, such as poor randomization, lack of blinding, selective outcome reporting, or differences between groups at baseline, or missing participant data. Unlike random error, bias does not cancel out with more data. In fact, a biased study can give very precise but wrong results. So, to sum up with what we have talked about, random error means results vary by chance, but bias means results are systematically distorted. This is why in systematic reviews, we don't just look at the results and trust the results. We also carefully assess the risk of bias in each study. Now let's talk about the bias again. Bias is a systematic deviation from the true effect. In other words, it means the study results are consistently pushed away from the truth in one direction. When we talk about bias, we are mainly concerned with the internal validity of the study. Internal validity asks, can the evidence be believed? Or more specifically, how likely is that the results of the trial differ from the true effect the study intended to measure? If a study has a high risk of bias, its results may look precise, but they could still be wrong. This slide also mentions applicability, which relates to external validity. External validity asks a different question. Can the evidence be applied to real-world patients or settings? So to summarize, bias threatens internal validity, whether the results are trustworthy or not. Applicability relates to external validity, whether the results can be used in practice. In systematic reviews, we first focus on internal validity because if the evidence is biased, it does not matter how applicable it is. And the common practice in systematic reviews on treatment effect is to include and assess the evidence from randomized controlled trials. So we need to learn how to assess the risk of bias in randomized controlled trials. One recommended tool is the Cochrane Risk of Bias tool for RCTs. This slide summarizes the main points of this tool, including 5 risk of bias domains. The first domain looks at bias arising from the randomization process. We ask questions like, Was the random sequence truly random? Was allocation concealed? Were baseline characteristics balanced between groups? And the second domain focuses on deviations from intended interventions. Here we consider whether participants and caregivers were blinded and whether the analysis followed the assigned groups. And the third risk of bias domain examines missing outcome data. We ask whether a lot of data were missing and whether that could affect the results. And the fourth domain looks at measurement of the outcome. We check whether the outcome was measured appropriately and whether the same methods were used across groups, and whether the outcome assessors were blinded. The fifth domain assesses the selection of the reported results. This helps detect selective reporting, such as choosing only favorable outcomes or analysis. For each domain, reviewers answer signaling questions using options like yes, probably no, no or no information. And based on these responses, each domain is judged as low risk of bias, some concerns, or high risk of biases. Finally, an overall risk of bias judgment is made for each study. This structured approach helps ensure that risk of bias assessment is transparent, consistent, and not based on personal opinions alone. So, in this video, we talked about random error. Random error happens by chance and is closely related to sample size. Smaller sample size studies usually have more random variation. And then we talked about bias, which is a form of systematic error. Unlike random error, bias consistently pushes the results away from the true effect, and this threatens a study's internal validity. And in this video, we also talked about assessing risk of bias using recommended tools, and we focused on randomized studies. But there are other tools, such as Robbins Eye, used for non-randomized studies. If you are interested, there are resources on the internet about other tools. Thank you for watching.